Okay. Welcome to the Health and Government Operations Committee. This is voting list number 17 that we will be, is that right? I guess it is, that we will be voting on tonight. And I do, by the way, expect that we will have another voting session tomorrow, likely between session 1 and session 2 of the House. But stand by and pay attention, because I'm not sure exactly what's going to happen. As with everything today, tomorrow, Saturday and Monday, there will be a million surprises, and they'll surprise me and then I get to surprise you. So try to be kind and remember that I didn't make this stuff up. It comes my way. With that, we're going to turn to House Bill 821. Lisa.
This bill establishes the Career Pathways for Healthcare Workers program administered by the Division of Workforce Development and Adult Learning in the Maryland Department of Labor. The purpose of the program is to provide matching grants to hospitals or related institutions that pay for training programs attended by healthcare workers, with the goal of providing increased opportunities for healthcare workers to receive training across the state. A training program is one provided for healthcare workers by a historically Black college or university or a community college. The governor is required to include $1 million in the annual budget bill. There are amendments that were distributed. The amendments require that identified training programs be consistent with labor market needs, specify that grant funds are for training that was attended by healthcare workers, requires that wage increase information be given to interested healthcare workers, strikes a specific wage increase amount and specifies that a wage increase be consistent with market trends, and provides that grant funds pass through a specific fund based on certain bargaining agreements.
Delegate Kelly.
Thank you. So the subcommittee passed this with the amendments unanimously. The amendments were those discussed by the Hospital Association. These are the same amendments that are on the Senate bill that came over to us. And this workforce program is going to be matching grants. The employers can pay for people to move up in their healthcare training. So the whole committee unanimously thought it was a great program. I move the amendments.
Second.
Is there discussion of the amendment? All those in favor say aye. All those opposed, no. The ayes have it. Delegate Kelly. I didn't hear you. Is there a second?
Second.
Discussion on the bill is amended. All those in favor say aye.
Aye.
All the opposed say no, and raise your hand in the panel, which I'm opening up. Good. The bill passes unanimously. House
Second.
Bill.
Oh, sorry.
House Bill 1439, Lindsay.
Did you skip one?
Sorry, I guess I did.
Mm-hmm.
How about 1005?
Yes.
That would be the one.
House Bill 1005 requires Medicaid, subject to federal approval and limitations of the state budget, to provide community violence prevention services beginning July 1st, 2023. The Maryland Department of Health must apply for a federal waiver to provide the services, and if the waiver is denied, the bill is null and void. Medicaid, under the bill, Medicaid must provide community violence prevention services to a program recipient who has been exposed to community violence or who has a personal history of injury sustained as a result of an act of community violence and has been referred by a certified or licensed healthcare provider or social services provider to a certified violence prevention professional to receive community violence prevention services after the provider makes a determination that the Medicaid recipient is at an elevated risk of violent injury or retaliation resulting from another act of community violence. The bill also provides that a prevention professional seeking certification as a certified violence professional must complete an accredited training and certification program for certified violence prevention professionals that is approved in accordance with the bill, and that the individual must maintain that certification that is completed. The bill requires that on or before January 1st, 2023, MDH must approve at least one accredited training and certification program for certified violence prevention professionals, which must include at least 35 hours of initial training that addresses the profound effects of trauma and violence in the basics of trauma-informed care, community violence prevention strategies, including conflict mediation and retaliation prevention related to community violence, case management and advocacy practices, and patient privacy and the federal HIPAA, patient privacy and HIPAA concerns, and includes at least 6 hours of continuing education every 2 years. An entity that employs or contracts with a certified violence prevention professional to provide community violence prevention services must maintain documentation that the certified violence prevention professional has met the requirements of the bill and ensures that the community violence prevention professional is providing services in compliance with any applicable standard of care, rule, regulation, or state or federal law.
Delegate Penny Melnick.
Thank you. We discussed this bill in the committee. It was a partisan vote. Basically, this program that this bill proposes is really based on evidence-based, well-researched, highly regarded. As a matter of fact, the federal government has developed a new waiver that would allow for community violence intervention workers to be reimbursed through Medicaid for these services. In Maryland, we have such a program at the University of Maryland School of Medicine and with some of the hospitals like LifeBridge, where they basically have the doctor, they have the patient, and the social workers, the trauma, the case manager. They're the ones that make the referral for the violence prevention professional. These are people that take the training that is developed by the HABI, which is the entity that is nationally recognized. It is a curriculum that is accepted with the 35 hours of training plus 6 months on-the-job training. The bill will call for the development of this certification by the Department of Health for these individuals. And then the bill says that if the waiver is not granted, the bill is null and void. This is a way to prevent violence. This is for victims only, so that they're not again re-victimized, so that they're not in the system, because Medicaid pays for 2 out of 3 people that are shot in Maryland. So this is a way to save money as well. It is highly regarded and used in New York, California, LA. This is not just for gang members. There's nothing in this bill that says that this program is to be run by gang members. This is a training program that will be developed by the department and people can take it. And these programs I was looking at before I came on this voting session, if you go to YouTube, you'll see the MedStar Washington Hospital Center has a great a video on some of the workers, and they interview them, how they can help the patients. And they don't do any medical care at all. They help some of them with finding them jobs, with helping them manage their care, with appointments, with being there and giving that support that they often don't have at home.
Delegate Morgan.
Thank you, Madam Chair. So understanding this bill, it's for victims of community violence. But I'm reading the fiscal note, and it talks about training the 35 hours for different people to become certified in getting a license, I guess, as a prevention professional. Who is applying for those licenses? Like, are these past victims? I think that's where there might be some I'm having a hard time understanding this.
Yeah, so this program, and by the way, this bill passed unanimous in the Senate. This program actually that we are saying will be, the department has to approve one accredited training and certification program for these certified violence prevention professionals. So, whoever wants to apply for it, right, will take the 35-hour training. They will have to do on the job training. So the bill doesn't say who can and cannot apply for it.
Okay, I didn't know if that was like a past requirement that you had to be a victim or something, to
No.
relate to these people.
No, it's not.
People that are current victims, I guess.
Right.
So it talks about the expansion of Medicaid, but it doesn't talk about I guess, grant funding and 60% is coming from the feds, 40% would be coming from the general fund, but it doesn't give a total amount. Do we have any estimates on the total amount that we're expanding Medicaid?
So this will be, they will have to apply for this waiver through Medicaid, and Medicaid will pay for, I believe it's the state and Medicaid. I'm looking for my fiscal note. Maybe Aaron have it. You have it at your fingertips. 1 minute. It says here, should a federal waiver be granted, Medicaid expenditure, 60% federal, 40% general fund.
Okay, but we don't have a total amount, like it's.
No, we don't, but we
and
did hear from the testimony that only 20% of all the people that will fit into this population would qualify. So I understand that it's about 1 million. Am I right, Erin?
Right. So the fiscal note took into account that between October 2015 and October 2017, that 11,000 Medicaid enrollees were treated in hospitals for intentional interpersonal injury. So that was 5,575 individuals. But then those individuals would have to fit into the parameters of the bill. So they would have had to have been exposed to community violence, or they would have had to have a personal history or an injury sustained as a result of community violence. And the individual who testified before the subcommittee stated that he believed that about 20% of those 5,557 individuals would actually qualify under the bill, which would bring in a fiscal note of around $1 million.
Okay. Well, that was very helpful. Thank you. Thank you, Madam Chair.
Thank you for the question.
Any other questions? Delegate Krebs.
Thank you, Madam Chair. First of all, I just want to go back to what the subcommittee chair said about the vote being along party lines. And I've often tried to say in this committee, it's not party, it's philosophical differences. And one of the things that I've tried to do in this committee over the years is look at the problem we're trying to solve. And there is a problem here, obviously, we're trying to solve. And then what's the solution? And then one thing I think we fail to do frequently is follow up. And we pass program after program after program after program, and we never follow up. We just keep adding on and adding on. And at some point you got to say, okay, did the program work? And after we passed it, we just keep adding programs. And when you look at some of our statistics, and I don't think we're getting a lot better in a lot of these issues. But anyway, I'm reading the testimony from the Maryland Psychological Association. And again, it's a problem that I think we all agree needs to be solved, and we could do some work on. But if you read the Maryland Psychological Association testimony, it said, we applaud the intent, but have serious concerns about the implementation of the bill as written. It requires a clinician to make a risk assessment for potentially being a victim by an unknown person. Very unclear about how the clinician is to determine if the person is at elevated risk. And they go on to ask some very pertinent questions about the bill, about how's the bill going to actually operate. And then Anne Arundel County Department of Health has some of the same concerns. And I guess I'm not on the subcommittee, but based on, again, I think we all agree there's a problem here we need to solve. But have we addressed these issues that are brought by the organizations that actually do this work? And how will we follow up to find out if this is working? And did the subcommittee talk about that?
So if I may, we did actually, Delegate Shalega brought up the letter that you're referring to. So if you look at the bill on page 3 and you look at line 24, you will see that in order for a person to be referred to a community violence prevention, actually to be referred to community violence prevention services, it must be done. And this is why I think that the organization did not quite understand or read the bill well. They must be, it says line 24, been referred by a certified or licensed healthcare provider or social services provider to a certified violence prevention professional to receive community violence prevention services after the provider, and here's where it's the key words, makes a determination that the program recipient is at an elevated risk of violent injury. And again, the provider is that person that is certified or licensed, or retaliation resulting from another act of community violence. So the community violence prevention person cannot just come and say, I'm going to serve you. No, they must be referred by a certified or licensed healthcare provider that must make a determination, and they're the ones that refer their patient to this individual.
So will the state develop or assign a credentialing body that can determine who can employ these specific positions and then who to be reimbursed and be paid?
So the state, Heather Scheck was in the meeting, and she stated that they would actually promulgate regulations to address, for example, one of the questions that came up by a delegate was, how about a background check? She says that the delegation can address that it didn't need to be in the bill. So under the bill, the state will have to be the one, the Department of Health will be the one that will develop this certification in this program, and they would put in the guardrails. But just to let you know, there is actually a model program that is recognized that the local hospitals are using. So the state won't have to reinvent the wheels because they're model programs that are recognized and respected in the medical community. So they will probably look at those programs and do something similar, which is what they do with anything else when we pass a bill, because there are programs out there already being done. This is just a way to get Medicaid to reimburse and pay for these services that create the prevention for people that are victims.
No, I agree. Overall, it sounds very good. It's just when you get into the details of how it's going to work and we just throw it out there, I think there are some concerns, some legitimate concerns that I don't see written in the bill. And we punt it to the department. They're not the lawmakers. And I think we should spend some time trying to get to the details of these things and then have follow-up. 2 years out, 3 years out, how's this all working? We put it on auto drive and just say, hey, we did something. And, maybe we did, maybe we didn't. We don't ever really know. That's just my concern. And I wish we'd spent a little more time vetting this.
Well, may
I interrupt, and may I invite Delegate Rosenberg to mention what's going on in Baltimore City, please?
Thank you, Madam Chair. Can everybody hear me?
Yes, thank you.
Okay. Well, I'm specifically aware of what's going on at Sinai Life Bridge, that this is a merger of a program that was dealing with these issues in the heart of Baltimore, now creating a new center of hope on the adjacent to the basic Sinai campus, adjacent to the racetrack. And so this is state of the art. And you've got to get through Medicaid. You just can't put a program up and say, we've got a good track record. This is Medicaid approved in addition to what has to happen through the state health department and the ALR process. And this is different from the programs that were recently featured and criticized on a television expose. This is professionals providing treatment so that people do not get involved. People who have been harmed do not get involved in revenge actions. Thank you, Madam Chair.
Thank you, Delegate.
And
Did you
Madam
have-
Chair, if I
Yes,
may,
Delegate Penny Melnick.
Thank you. The bill requires training program to be accredited on page 4, line 4. So we do have details in the bills for the department. And also, if I may, this bill was supported and is supported by the emergency physicians, the hospitals, or professional counselors, because they know that it's work and the hospitals are doing it.
Thank you.
My pleasure.
Delegate Chisholm.
Thank you, Madam Chair. And I'm along with Delegate Krebs, I applaud the intent of this bill. And of course, emergency rooms are concerned because they see so much violence coming in the door. And at this point, I'm sure they're willing to do anything to try to stop it. And I did have a nice conversation with Delegate Smith about this in the subcommittee. My biggest concern with it is a couple of things. One, it is not well defined in the bill on who's going to be doing the training. I appreciate the fact we want to call them professionals, but we're talking about 6 months of training, and then they go into the field with somebody that we don't even know if they're trained well. And to Delegate or in the Vice Chair Penny Melnick's point of saying, well, this is a provider saying we know this person is in danger and is going to experience violence again. Well, if that's the case, we should be bringing in law enforcement to try to prevent those things. I think these programs are awesome and they do work in certain circumstances, but we have to be more descriptive on how we're going to do this. And I don't want to be flippant about this, but there are a million different nonprofit organizations involved with trying to provide these things. And the fact that we keep talking about Medicaid like it's just free money, it's not. It breaks the system at some point. And it's not that it's not worth the taxpayers' money, but we need to make sure the taxpayers' money is being used in a very prudent and proven way, instead of just saying, we're going to try this program and not be very descriptive. Because even Delegate Smith, in her letter, and then when I asked her about it, she said it's not just the victim, it's also the victim's family and the victim's neighborhood, and whole neighborhoods can be affected by this. There's no doubt about that, but where does it end? I mean, the tentacles are so big on this, and this net is so big that it can end up just being wrought for fraud and abuse and not really helping the people it was intended to help. And to Delegate Krebs's point, we have to have follow-up on these things, but more importantly, we have to have a very narrowly written criteria for who's going to fit in and how are we going to make sure we're certifying the right people to implement these types of programs.
Delegate Lewis.
Thank you, Madam Chair. And thank you, Madam Vice Chair, for walking us through the bill. To follow up on Delegate Chisholm's question, it seems like the heart of his concern has to do with the definition of a training curriculum for certified violence prevention professionals. The bill clearly states on page 4, line 8, that the Department of Health will approve an accredited training and certification program for certified violence prevention professionals. The bill further outlines the high-level content of the training to include, training on how to address trauma-informed care, violence prevention, conflict mediation. The high-level topics to be included in the training are in fact outlined in the bill on page 4, as I mentioned. But I think if I'm understanding Delegate Chisholm right, he's also concerned about the process by which the Department of Health will identify a certified training program. And my question is, can anyone share an example of how the Department of Health identifies and selects training curricula for health professionals under its jurisdiction? Does the department make up trainings, or does it identify certified training curricula produced elsewhere, for example, at the Harvard Chan School of Public Health, where violence as a public health issue was first got, very serious attention? Do they go through a catalog of training curricula? Can anyone here talk about how the health department chooses training curricula?
Delegate Penny-Melnick, do you have any information about that?
Yes, I could tell you that, for example, for the implicit bias training, they went online and found organizations that do it and just basically chose, a couple of those. They also go online or make calls and find out who is highly respected in a certain area, what department or what curriculum is being used by most people and is accepted in the community. And that's how they choose it. They don't develop their own programs. And that is basically how it's done. In this program that we're talking about, there is an organization, the HIVA organization, that is actually highly regarded and accepted and is what people use. So I would imagine that that's what they would do. And then they would do as they do when they promulgate regulations, some things that are more personal to Maryland and some of the issues that they promised to address, for example, during a hearing.
Thank you. And may I quickly follow up, Madam Chair?
May.
So when the health department is searching for curricula, will they use the guidance on the subject matter we've spelled out in the bill to select an appropriate curriculum? Have we given them enough guidance in the bill so that they can sift through the options and choose a curricula that meets our statutory requirements?
And I would say we have on page 4, especially when you start on line 1, where it says whether certification, when it has to be done by, that it has to be 35 hours, that, it has to address what you read. I'm not going, in the interest of time, go through it again. But if you look at line 8, all the way to line 26, it gives them very specific guidelines as to what that program should look like.
Thank you so much. Thank you, Madam Chair.
Thank you. Delegate Bagnall, followed by Delegate Kipke.
Thank you, Madam Chair. I just wanted to sort of follow up on Delegate Chisholm's comments, because I know that Delegate Smith did talk about, how injury and trauma can spiral out, that they impact the family, they impact the community. But my understanding is that so too does healing, and that this bill is focused and targeted on the impetus of that continued violence and breaking that cycle of violence. And I believe that the CDC actually recognizes risk factors for violence. So my understanding is, again, that this is not something new that we're trying. It's just new to us. Is that correct?
That's correct.
Thank you.
Delegate Kipke.
Thank you, Madam Chair. I think I heard earlier, and maybe in a prior conversation, that many other places are doing this already. And so did I hear that correctly? And if that's true, and I've heard, data and science thrown around more this session than probably ever. What does the data show? I mean,
I'm shocked.
It sounds what we're trying to do here, Delegate. Yeah, it sounds what we're trying to do here sounds good, but I'm curious. Forgive me, but I'm a skeptic that a 35-hour course is going to have some profound impact on an individual. I mean, I don't want to downplay it. Maybe it does. Maybe I'm wrong, but is there any data that shows that this has a profound impact on outcomes? I mean, potentially this could cost a lot of money and millions of dollars, and based on all these other places doing this, is there data that shows, have studies been done that shows that people's lives are changed so that they're not showing up in the ER bloodied up again based on bad behavior or others' bad behavior?
Yes, if you look at the fiscal note and look at page 3 at the bottom, it says, according to a recent article in the Journal of Trauma and Acute Care Surgery, Medicaid is the largest payer, 39% of violence-related care, both nationwide and in Maryland. Violence prevention programs have been shown to be effective at reducing subsequent violent injuries. To the extent that the provision of the community violence prevention services reduces subsequent injuries among Medicaid enrollees, Medicaid expenditures may also decrease by an indeterminate amount. There is a growing body of research. I know I've been doing a lot of reading. They show that community violence can be prevented using public health interventions. Also, according to the Centers for Disease Control and Prevention, homicide is the leading cause of death among Black males ages 10 to 19 and 20 to 24, and also in the Latinx. And the data shows that when you use public health intervention, many of these kids are not victims again and do not retaliate. So it does work.
Okay, thank you.
My pleasure. Thank you for the question.
I see no other hands. I don't think we have amendments on this bill. So Madam Chair, Subcommittee Chair, my Vice Chair.
Yes, sorry. I moved the bill.
Second.
Are there amendments?
No.
No
No, okay.
amendments.
Sorry. Okay.
It's
All
okay. Thank
those
you,
in
Question.
favor of House Bill 1005, please say aye. And
Aye.
all those wishing to vote against the bill, please raise your hand. And I will read your names so we make no mistakes. I see Delegate Shalega, Delegate Chisholm, Delegate Riley, Delegate Krebs. 4 votes will be registered no. Have you got that, Richard?
Yep, got them.
Excellent. And everyone else, I presume we're all present? Everyone else will be recorded green. And thank you for that really helpful discussion. I think it was good to talk about it, and I appreciate the respect that everybody on this committee shows everyone else. That really, you're giving me a great send-off, guys. That's all I can say. Thank you for that. House Bill 1439. Wait, we did that. Or maybe not. I've lost track.
No,
But
We have not.
1439 is where we are.
Yeah.
That would be Lindsay.
This bill includes the city of Bowie as a participating jurisdiction in the Maryland Intrastate Emergency Management Assistance Compact. It was considered in Government Operations Subcommittee and there are no amendments.
Move the bill.
I couldn't have said it better.
Is there a
Second.
second?
Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. It passes unanimously. Senate Bill 9. Lindsay.
This bill requires the Maryland Department of Transportation to study options for streamlining the certification process for minority business enterprises. It also requires specified state entities to provide information requested by MDOT to assess the need for remedial measures. Each entity must require licensees, pre-approved licensees, applicants, grantees, and other program participants to provide the information deemed necessary within 60 days of the request. There are amendments that begin on page 5 of your packet that were considered in Government Operations Subcommittee that make the requirement to provide certain information applicable to DGS rather than DBM with respect to projects in a certain capital grant program for which minority business enterprise subgoals for the capital project have been established, require an entity to provide the information to MDOT within 75 days of a request to align with the time period requirements for the entity to make a request, receive information back, and in turn provide that information to MDOT, and clarify that the need for remedial measures refers to the implementation of a program to support businesses owned by minorities or women.
Delegate
You-
Rosenberg.
Thank you, Madam Chair. The amendments came from MDOT and the Attorney General's office. Unanimous vote, 47-0 in the Senate and 6-0 in subcommittee. Would move the amendments.
Second.
Any discussion on the amendments? All those in favor say aye. All those opposed, no. The ayes have it. The amendment passes unanimously.
Move the bill.
Second.
Thank you.
Any discussion on the amended bill? All those in favor say aye. All those opposed, no. Please raise your hand. Seeing no hands, the bill passes unanimously. Senate Bill 242.
You can come in. The next bill's not mine.
Oh, good. That would be Aaron.
Are we sure?
You were actually going to hold this one till the next voting.
Oh, I'm sorry. I am holding this bill. I need to hold this bill. So we're going to move on to Senate Bill 250. Thank you, Aaron. Lindsay.
As this bill came from the Senate, the bill makes interest on unpaid invoices under state procurement contracts due and payable after 30 days, down from 45 days in current law from when the agency receives an invoice. It requires the Department of Legislative Services to conduct a study and report on the processing and timing of payments to contractors under state procurement contracts. It also requires the Department of Information Technology to consult with specified agencies and report on the status of the comptroller's online payment portal and the planned upgrade to the state's financial management information system and related issues. The bill expresses legislative intent that any upgrade to FEMIS include goals to significantly reduce the amount of time in which payments are processed. The bill generally takes effect July 1st, but the provision related to the accrual and payment of interest on unpaid invoices takes effect June 1st, 2023. So essentially, this bill is similar but not identical to the cross-file on the bill. So there are amendments that begin on page 16 of your packet that make the interest on unpaid invoices due and payable after 37 days, up from the 30 days in the Senate. This is aligns the bill with House Bill 325, the cross-file. It retains the added DO-IT reporting requirement, which was another difference from the cross-file House Bill 325, but the amendments clarify the report date for the report from DO-IT in the Senate bill. And they were considered in Government Operations Subcommittee.
Delegate Rosenberg. You're muted, Delegate Rosenberg. And Richard, would you just mute everybody but me and whoever is speaking at the moment? I see a few microphones and there was some background noise. Thank you. Delegate Rosenberg, you ready?
Yes, I am. As council said, this conforms the bill to House Bill 325, which has passed the Senate.
We're having trouble hearing you, Delegate Rosenberg.
This would conform the bill to the House cross-file, and that bill has passed the Senate. This was.
Do you have a piece of paper on your computer, Delegate Rosenberg, or something, or your hand?
My hands are
Try
behind my
again.
back. Okay.
There you go. There you go. You did something again.
Okay. This and the House bill are conformed. The House bill has passed the Senate and the House bill passed the House, I believe unanimously. So it would move favorable.
Move the amendments.
Is there a second? Is there a second?
Second.
Any discussion on the amendment? All those in favor say aye. All those opposed, no. The ayes have it. The amendment passes unanimously. Delegate Rosenberg,
Move the bill as amended.
Second.
any discussion? All those in favor say aye. All those opposed, no. Please raise your hand. Senate Bill 250 passes unanimously. Senate Bill 273, Aaron?
There is an amendment to this bill that would conform the bill to its cross-file as passed by EHE. The EHE passed the bill with a amendment that instead of requiring MDE to buy back the firefighting foam from the fire departments, they would do a take back program. Senator Elfreth at the bill hearing did mention that she supported that amendment, as does Delegate Love, whose bill it was in the House. The House bill passed actually, I'm not sure if it was unanimous. I think it was. Let me make sure. I believe it was unanimous. But this would conform the bill to the Senate bill as it passed EHE.
Delegate Pena-Melnick.
Everything she said, and I move the amendments.
Is there a second?
Second.
Second.
Any
There's a
discussion?
question by
It was
Shalay.
unanimous.
Delegate Shalega.
We put quite a bit of work into this. What were the amendments again? We didn't.
So this was actually offered by MDE. And so the bill would have required MDE to buy back the firefighting foam from the fire departments, and it would change that to a take back. The rationale from MDE was they're given $500,000 in the bill to implement the bill to dispose of the firefighting foam. So they'd rather use that money to actually dispose of the foam, do the other requirements under the bill than pay the fire departments for the firefighting foam.
Okay, but we didn't mess with any of the PFAS, the actual
No,
language on the.
No,
count.
none of the definitions have changed or anything like that.
Thank you.
Thank you, Delegate Shalega. Delegate Kipke, followed by Delegate Chisholm.
Thank you. I'd just like to request that I be marked as excused on all the votes related to this bill. Thank you.
You will be marked excused. You got that, Richard?
Yes, I do.
Thank you. Delegate Chisholm.
Probably not relevant to the bill, but did anybody, after the amendment was put in, did anybody reach out to the fire departments? Is this going to put them at a financial burden? I mean, what kind of money are we talking about if they're not being paid for it now and MDE is just going to be taking it back? Have they large supplies of this?
Do we have an answer to that?
I can't honestly answer that question. You could wait till tomorrow.
Okay, I see Delegate Hill has her hand up. I suspect she has an answer to that. Would you like to?
I can offer an answer. It is not authoritative, but the firefighting companies would have already paid for this. It is something they won't be allowed to use. So they're not out of any money. It's just like anything else that sits on your shelf and you have to throw away after an expiration date. What they're not gaining is to be made whole for what they purchased and could not use. It would also stop them from, anyway, that's my understanding of it.
Delegate Hill, would you assume that it would save them money because they don't have to dispose of it in some environmentally safe way?
I think that is also an excellent point, Madam Chair. As long as MDE takes it off their hand, it's no longer their problem. It was money they had already spent. They're not going to recoup it. That's it.
But on the record, I did not hear from anybody about this. So we can't authoritatively answer the question, but logically we can go down that path and have thoughts about it.
And I can tell you that it's passed EHE and it's on, I believe, third reader in the Senate in this form, and have not heard any complaints. And I did talk to EHE staff about the amendment.
And they're the ones that wanted the bill, so it's fine. I know that they were the big proponent to make sure that we eliminated this product anyhow. So
Yeah.
it's fine. Thank you. Thank you, Madam Chair.
Delegate Shalega, thank you for your patience.
Sorry, one more question. I know the Senate bill was different than our bill. So we're conforming the Senate bill to the House bill with the exception of the take back, right?
No, the bill before you, the Senate bill, is how the Senate has passed the House bill.
Well, we want to go back to this House version. I mean, we put a lot of work into the House bill, and that's why it passed unanimously.
Yeah, they look the same.
Okay, there was some packaging, food packaging and stuff.
That is the same. That is
from our House version, not what the Senate did to it.
Everything is this with the packaging, both bills are the same.
Okay, so they must.
Is it true that the only difference will be a take back versus a
Yeah,
buy
so
back?
that's the amendment that's being offered today.
But otherwise, it's the same as the bill the House passed.
Yep. Yes.
Not what the Senate passed. It's same as what the House passed. Okay, thank you.
The bills will conform if you pass this amendment.
If I may, Madam Chair, and I have Delegate Shalega, I'd spoken to some of the industry, the lobbying that is, and they're fine with what we're doing. Because it's the same thing that we did in the House, as you said, and you helped. We did a lot of work on them.
Okay. Thank you. with that, I would like Delegate Peña-Melnick to possibly move the amendment.
I move the amendments, Chairman.
Second.
Second.
So, maybe we did discussion, but we're doing discussion now. I see no further hands. All those in favor of the amendment say aye. All those opposed, please raise your hand. The amendment passes unanimously. Delegate
I move the
Peña-Melnick.
bill as amended.
Second,
Discussion? All those in favor say aye. All those opposed, no. The ayes have it. I see no hands. The bill passes unanimously. We will move on to Senate Bill 350. Aaron.
Mhm.
That is identical to 1005, which this committee just voted on and passed.
Delegate Kipke.
Please mark me as excused on all issues or all.
Oh,
votes.
sorry. It's
I'll
that
move the bill.
All right. Is there a second?
Second.
second,
All those in favor say aye. All those opposed, raise your hand. I see no hands, but Delegate Kipke will again be registered in the excused. The bill
Thank you, Madam
passes.
Chair.
Yes?
I'm sorry, just a point of order. So I have one abstain available. Is, just to be clear, that's not what Delegate Kipke is doing.
Abstain works.
If there isn't a category of excuse, that's exactly what Delegate Kipke is doing. And on the floor, it will be called excused because we don't have an abstain on the floor. It translates oddly.
Understood.
Actually stupidly. But that would be
Okay.
nice. If they use the same word for the same thing.
Got
Call
it.
it excused.
Thank you.
And Delegate Kipke, you're happy with that, correct? Thank you. Okay, so Senate Bill 350. No, that was Senate Bill 273 that just passed. We will move to Senate Bill 350. Aaron.
You just
Oh.
Senate Bill
No,
53.
we just did that.
Oh, I thought that Delegate Kipke was concerned about the PFAS bills.
I was, Madam Chair. Thank you. I think I misspoke.
I think you did, and
Senate Bill-
you right down that rabbit hole with you, which
Yeah,
is easy to do.
Yes, Senate Bill 350. Move the bill.
Okay, so Delegate, yeah, okay, 350.
So to be clear, Delegate Kipke is going to be excused from 273, and we've passed 350 already.
That's right.
Mhm.
Okay.
Okay. All right, sorry for the confusion. I see Delegate Krebs and Delegate Riley.
I would just say consider the vote for 105 the same for 350. It's the same bill, correct?
Correct. Let's
So
do
I would
that.
just put my vote the same as the,
Oh, right. So we have Delegate
yeah.
Krebs, Delegate Riley, Delegate Chisholm, and there was a fourth.
Delegate Shalega, I believe.
Delegate Shalega is the fourth. So those are the
Thank you.
4 no votes on Senate Bill 350. It did not pass unanimously.
Unless
okay?
anybody changed their mind.
I don't think so. But you're welcome to if you'd like to, Delegate Krebs.
No, I was thinking some of you might want to change your mind. Just to think outside the box a little bit, you know?
That is way outside the box. Delegate Hill, do you have your hand up for?
yes, I do, Madam Chair. Since we were going back and forth between the Senate and the House, is it too late to ask to be amended as a sponsor onto the House version of the bill, which is Senator's 1005, House Bill 1 of the Maryland Medical System?
That bill's not amended at all.
Oh, it had no amendments. I misunderstood. Thank
So
you.
with no
Okay.
amendments, it's can't be done, but thank you for asking. It was a good suggestion. Okay, we are now moving on to Senate Bill 373, unless someone corrects me, and that would be Lindsay.
As amended by the Senate, this emergency bill specifies that when the State Highway Administration, the Maryland Transit Administration, or an agent, employee, or consultant thereof gives or posts specified notice of entry onto private property to conduct environmental and engineering studies, they must send, a copy of the notice to the General Assembly members who represent the legislative district in which the property is located. There are no amendments on this bill, and this committee voted yesterday to concur with the identical cross-file 163, House Bill 163, and the full House voted on that concurrence earlier today. It'll be identical.
If he is not excused, this would be appropriate for Delegate Kipke to move favorable.
Move the bill.
Second.
Second.
Any discussion on Senate Bill 373?
I would just say Delegate Carr has been very gracious about agreeing to, this is a very pared down version of a bill that you worked on for several years. But what it does, and I mean, the votes are there, I should shut up, but it gives us the opportunity to better represent our constituents when these circumstances arise. Thank you.
Okay, the bill has been moved and seconded. Is there any discussion? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. Senate Bill 518.
It's identical to House Bill 821, which we passed unanimously earlier on this voting list.
Move the bill. Is there a second? Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously.
Madam Chair,
Yes?
can I follow suit with Delegate Hill and request to be amended onto the House version of this bill? Because I missed
Which
the
does have
opportunity.
amendments. It does have amendments.
5-8, what's the cross of that?
21.
821.
House Bill 21? Oh, 8.
House Bill 821. It's a good one to have sponsors on. I think that's a great idea.
fine. That's just fine, as long as there's an amendment on it.
Yeah.
Okay. Is there anyone who does not want to be a co-sponsor of House Bill 821? You need to put your hand up if you don't want to co-sponsor the bill. Okay, we'll all be co-sponsors of House Bill 821. And our friends Delegate Turner and another committee who I personally miss, and Delegate Landis will be pleased with that, I'm sure. Good work, Delegate Landis. Okay, and again, I'm going to ask my Richard to mute people who are not speaking, because again, I see these things change. We are now on Senate Bill 644. Lindsay.
This bill requires the Department of General Services, in consultation with the Governor's Office of Small Minority and Women Business Affairs, to study the feasibility and impacts of establishing a state procurement percentage preference for businesses located in historically underutilized business zones, and report by December 1st, 2022, its findings and recommendations to the General Assembly. There are no amendments, and this was considered in Government Operations Subcommittee.
Delegate Rosenberg.
Yes, this is a study. It's really broadening the principle of minority business to the underserved areas, and therefore a Republican bill. So it favorable by the committee.
And it was unanimous, I presume.
Yes.
Okay. Would you like to move the bill, Delegate Rosenberg?
No, so moved. Thank you.
Second.
For second.
Second.
Is there any discussion of this bill? All those in favor say aye. All those opposed, no. Please raise your hand. I see no hands. The bill passes unanimously. Senate Bill 720, Lisa.
There is a technical amendment on this, but otherwise it is identical to House Bill 1034.
Which we voted unanimously, move the amendment.
Is there a second on the
Second.
amendment? Is there discussion on the amendment? All those in favor say aye. All those
Aye.
opposed, please raise your hand. There are no hands. The amendment passes unanimously.
The
Delegate
bill is
Kelly,
amended.
second somewhere?
Second.
Any discussion? All those in favor, please say aye. All those opposed, please raise your hand. The bill passes unanimously. Senate Bill 859, Aaron.
This bill has been amended to conform it to House Bill 1188, which was passed unanimously in this committee and it was compilation of all the sickle cell bills that this committee heard. The Finance Committee will be passing House Bill 1188 clean, and therefore both bills would conform.
Move the bill or the amendments.
Amendment, is there a second?
Second.
As always, we do such a good job in HGO making these bills right. And I guess Pam Casemeyer had some role in helping us get there. So we need to say thank you to her. All those in favor of the amendment, say aye. All those opposed, no. Oh, Delegate Krebs, I seem to have missed you. Are you knowing or are you questioning?
No, I'm just trying to figure out what's 1176 then?
It's 1188, and it was the statewide advisory council on sickle cell, and it just basically has them, instead of creating a registry, they would do a work group on what a registry would look like. They would provide sickle cell information at healthcare fairs. There was information on sickle cell. I'm trying to remember the
So I'm just asking, so 1176 was just a similar bill that's not the cross file?
1188 was a similar bill that was not the cross file, correct? But
But
this
it has become identical. They are identical now.
and
Right,
this
so
committee,
So I could take my 1176 folder, my 1188 folder, and they've all been combined into this. Is
yes,
that right?
correct. Yes.
I'm just trying to
That's
track
correct.
what I'm doing here. Okay. Thank you.
So I think I did all those in favor, and all those opposed, please raise your hand. And I didn't see any hands except Delegate Krebs. So I'm going to assume this bill passes, or the amendment passes unanimously. Okay, will someone move the bill?
Move the bill as amended?
Second.
Any discussion? All those in favor say aye. All those opposed, no. Please raise your hand. Seeing no hands, the bill passes unanimously. Senate Bill 932, Lindsay.
This is the identical cross file of House Bill 1439, which you all voted unanimously earlier in this voting session.
Move the bill.
Second.
Any discussion? All those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. And that completes the work before us tonight.
Concurrences, please.
Oh, concurrences, it doesn't exactly complete the work. Thank you for rescuing me, Lisa. Okay, should we start with, we have 3 concurrences, I believe, in my hand. House Bill 775.
So this bill, there was actually Senate Bill 51 that is with the governor now, and that bill was in appropriations. And that bill would establish a pediatric cancer fund that's being funded in this year's budget at $5 million. Senate Finance and B&T amended House Bill 775 to conform to Senate Bill 51. Instead of just establishing the income tax checkoff, it would actually establish the fund that will be funded with $5 million. So that is what the amendments do to House Bill 775.
So I'm going to move to concur. Is there a second?
Second.
Is there any discussion on the concurrence? All those in favor say aye. All those opposed, no. The ayes have it. We will concur, move to concur on the floor. This is House Bill 1034. Lisa. Lisa, if you're talking, you're muted.
Sorry, this is the
Okay.
the assisted living manager's licensure bill. We just passed Senate Bill 720 with a technical amendment. So this is the House version with the technical amendment passed in the Senate.
And this is a technical amendment, Lisa?
Yes.
Madam Chair, may I ask a question?
Yes, you may. Let me move that we concur and get a second before we open it to that, though. Is there a second? I move to concur.
Second.
Second.
Delegate Lewis.
Thank you, Madam Chair. My only question is, what bill are we talking about and where are these concurrences? I don't know where this is. I don't have.
You don't have it.
anything.
You're absolutely right. You don't have it.
Okay,
This
thank
is the
you.
mystery stuff that goes on that I have in my hand that confuses me, that comes eventually from the clerk's office, and you see me stand up and moving to concur. That's what these things are. And I could read you what's on my sheet of paper, but you would be no more enlightened than you are right now.
I accept, the confusion. Thank you.
This is the State Board of Examiners of Nursing Home Administrators renaming licensure of assisted living managers and penalties. And this is the House version. We just passed the Senate version, which was Senate Bill 720.
Okay. Does anybody else want me to clarify their confusion for them? Okay, Delegate Riley. I think you're muted, Delegate Riley. We'd love to hear your voice.
Sorry, I said it's a different confusion, but when we received our voting list, we received the amendments to SB 275 and HB 44. I thought we were going to vote on those.
I'm sorry, you're not on the concurrence that we're dealing with right now.
No, I thought we were done. So
no, we're not done.
Okay.
We haven't
With the
voted yet.
concurrences.
And we have
a lot of them.
2 concurrences. Well, we haven't
Okay.
voted on this one. We're discussing
Okay.
House Bill 1034.
Okay. Well, you'll let us know when we can bring
I
up something
will.
else. Thank
I
you
will
very
do
much.
that. Thank you,
Thanks.
Delegate Riley. Okay. All those in favor say aye. All those opposed, no. The ayes have it. It's unanimous. We will move to concur. House Bill 1073.
So this is the accessibility of electronic advanced planning documents bill. We passed the Senate version yesterday with a technical amendment. And again, this is the House bill with the same technical amendments.
So I will move to concur. Is there a second?
Second.
Any discussion of the concurrence? All those in favor say aye. All those opposed, no. Raise your hand. Seeing no nos, the concurrence is unanimous, and we will do that on the floor tomorrow. Okay, Delegate Riley and anyone else having any questions? Go ahead, Delegate Riley.
Okay, thank you. Yes, I was just inquiring about a bill that we voted unanimously out of a subcommittee earlier this week, SB 295 and HB 44. And when we received the amendments for the voting list today, those amendments were in there. So I was just under the impression that we were going to vote on those, and I didn't know if you forgot or.
They're not on my updated voting list.
Okay.
I don't remember why they're not there.
Okay.
I can ask staff if they recall. It may have to do with the fiscal note that we have to deal with.
Yeah, that's the ambulance bill.
Yeah,
Yes.
and I have worked out a solution so that
Okay.
we can pass the bill. I'm glad you asked, but I don't have the amendment in front of me. It is not perfect, but it allows us to pass something to make progress on this issue, which I think will be helpful. And I expect that that's why we will be voting tomorrow, probably between sessions, because I really do want to get the bill out.
Okay.
And I needed to do this because of the fiscal note to allow me to do it. So thank you for
I
asking.
appreciate your consideration, and I look forward to seeing it on the list tomorrow.
I hope so, Delegate
Okay.
Riley.
All right, thank you.
You're very welcome. Delegate Krebs.
Thank you, Madam Chair. Just in advance, while you're considering the fiscal impact, I also like you to consider, that's a bill that happens to be very important to our local volunteer fire departments that have trouble staying afloat. And I think it's very modest the way it is now. It's a phase in of $25 per year. It's a very slow phase in. So just be cognizant of the millions and millions and tens of millions of dollars of other funding we passed this year. And this is something that affects our districts that's really important to us. So keep that in mind, because we've sort of been spending a lot of money, and this is a drop in the bucket for our rural areas who volunteers provide the services. And we're struggling. So just keep that in mind as you're considering being careful in that fiscal note when we've had all these other fiscal impacts that we've put forward.
Delegate Krebs, I'm working hard to
I
get
hope
this bill out. And I'm going to tell you, there is no one today more aware of how much money we've spent and how much good we're doing with it than I am.
Thank you. Thank you.
Thank you very much, Delegate Krebs. And with that, we are adjourned, and I will update you tomorrow when we know when we're voting, okay? Thank you all for helping us get through another hard day, 3 more hard days, and then I'm going to miss you all very much. And I know you're going to miss me too, but maybe not so many meetings.
Well, you can always call us.
Oh, I just might,
Absolutely.
Delegate Saab. I just might. I probably will call you.